You wake up at 2:17 a.m. Your calf locks like a steel cable pulled too tight. A sudden violent contraction, stinging, burning, a deep, nauseating ache that feels like the muscle is trying to tear itself off the bone. You sit up, you grab your leg, you stretch your foot, you wait, and you tell yourself the most dangerous sentence in modern medicine. It's just a cramp. Now pay very close attention to this next part, because this single thought is how people lose legs, and sometimes their lives. Nighttime leg cramps and peripheral artery disease feel similar at first. That is not an accident. That confusion is the trap. One is a muscle screaming from temporary chaos. The other is tissue suffocating from chronic starvation. Your job tonight is to learn the difference before your body makes the decision for you. Let me tell you about the morning mistake. You wake up after the cramp fades. You walk it off. The pain eases. You drink some water. Maybe you blame electrolytes, magnesium, potassium, age. You move on with your day. And deep inside your leg, something continues to rot. Peripheral artery disease does not announce itself with fireworks. It whispers. It waits. It studies your habits. PAD is not a leg problem. It is a circulation failure. Your arteries are supposed to deliver oxygen-rich blood to your muscles, even at rest. At night, when you lie flat, gravity no longer helps blood fall into your legs. Your heart must push every milliliter against resistance. If your arteries are clean, smooth, elastic, that push succeeds. If they are narrowed, scarred, and rigid, the muscle starves. Starving muscle contracts, starving nerve misfires, starving tissue screams. That scream wakes you up at night. This is the biological shock most people miss. A simple cramp happens because the muscle fires too hard. PAD pain happens because the muscle cannot breathe. One is electrical, the other is ischemic. Let me make this painfully clear. A nighttime cramp is like a sudden power surge in a factory machine. Loud, violent, brief. Peripheral artery disease is like slowly shutting off the oxygen to the workers inside that factory. They panic, they revolt, they shut the system down, and they do it silently at first. Here is what is happening inside your leg at the microscopic level. Your calf muscle fibers need oxygen to relax. Without oxygen, calcium stays trapped inside the muscle cell. The muscle cannot release. That locked, pulsating pain you feel is not tension. It is suffocation. Now, why does this show up at night? Because during the day, you compensate. You walk. You pump blood with movement. You stop when it hurts. You rest. Blood flow catches up. At night, you lie still. No muscle pump. No help. The artery must perform perfectly, and if it cannot, your leg pays the price. Most general practitioners get this wrong. They hear night cramp and think dehydration. They think magnesium. They think benign. They do not think about arterial lumen diameter. They do not think about endothelial damage. They do not think about plaque acting like sandpaper on the vessel wall. But you should, because peripheral artery disease does not start with pain. It starts with injury. Years earlier, smoking, diabetes, high blood sugar scraping the endothelium raw, high blood pressure hammering the vessel wall thousands of times per day, LDL particles slipping beneath the lining and oxidizing. Your artery responds by scarring. The lumen narrows from the inside, millimeter by millimeter. Quietly, you do not feel this, until demand exceeds supply, and nighttime is when demand wins. Here is the high-stakes truth. PAD is the same disease process as heart attacks and strokes. Same plaque, same inflammation, same endothelial dysfunction. If it is in your legs, it is in your heart. It is in your brain. Your leg pain is not the problem. It is the warning flare. Now listen carefully to this next distinction. This is where people fool themselves. A typical leg cramp hits suddenly and peaks fast. It eases within minutes when you stretch. It leaves soreness, not fear. PAD pain behaves differently. It builds, it throbs, it feels deep and gnawing. Stretching does little. Dangling the leg off the bed helps. Why? Because gravity pulls blood into a starving limb. If hanging your leg off the mattress brings relief, that is not a cramp. That is circulation failure. And here is the part no one tells you. As PAD progresses, the pain stops waking you up, not because you healed, but because the nerves died. That is when skin breaks down. That is when wounds do not heal. That is when toes turn black. This is the emergency, not the pain, the delay. Every year, people lose limbs because they dismiss nighttime pain as normal aging. Aging does not cause arteries to clog, damage does, and damage leaves clues. In the next part, I am going to take you inside your vascular tree. We will trace blood from the heart to the toes. You will see exactly where it gets stuck. You will see why certain arteries fail first, and I will show you the one anatomical location that determines whether you cramp or you decay. Most people have never heard of it. Doctors rarely explain it. But once you see it, you will never ignore leg pain again. You cannot understand this problem until you see the plumbing. So we are going inside your vascular tree. Blood leaves your heart through the aorta. A thick, elastic pipe, about 25 millimeters wide in a healthy adult, built to absorb pressure, built to flex. From there, the aorta dives into the abdomen and splits into two iliac arteries. Each iliac artery is narrower, about 8 to 10 millimeters, still muscular, still resilient. Then comes the first choke point. The external iliac artery passes under your inguinal ligament, a fixed structure, no room to expand. This is where damage accumulates. From here, the vessel becomes the femoral artery. Now pay attention. The femoral artery supplies nearly everything below your waist: thigh, knee, calf, foot. Its inner lining, the endothelium, is one cell thick, one fragile layer between life and tissue death. Every spike in blood sugar scratches it. Every cigarette bathes it in toxins. Every surge in blood pressure slams it against stiffened walls. LDL cholesterol slips beneath that lining. It oxidizes. Your immune system attacks it. Macrophages arrive. They ingest the fat. They swell. Foam cells form. Plaque is born. This plaque does not grow outward. It grows inward. The lumen narrows. Blood velocity increases. Turbulence rises. The endothelium suffers more damage. A vicious loop. Now follow the artery downward. The femoral artery becomes the popliteal artery behind your knee. This is the most abused artery in your body. Every time you bend your knee, it kinks. Every step compresses it. Every squat stresses it. Plaque loves this location. Now below the knee, the artery splits again. Anterior tibial artery, posterior tibial artery, peroneal artery. Each one smaller than a drinking straw. This is where most people cross the point of no return. Because small arteries do not tolerate plaque. They occlude early. They compensate poorly. Now think about demand. Your calf muscle is dense, powerful, hungry. It needs massive blood flow during walking. Even at rest, it needs oxygen to maintain tone. When those tibial arteries narrow, supply drops below baseline. This is when nighttime pain appears. But the pain is not random. It follows anatomy. Posterior tibial artery failure produces deep calf pain. Anterior tibial artery failure produces shin pain. Foot artery failure produces toe burning and arch ache. Location matters. Now let us talk about why this pain fools you. The nerve fibers that transmit ischemic pain travel alongside blood vessels. They fire when tissue oxygen drops. But early on, collateral vessels compensate. Tiny side roads form. Alternate pathways. This is why you can walk short distances without pain. This is why symptoms come and go. But collateral vessels fail at night. Why? Because blood pressure drops during sleep. Heart rate slows. Perfusion pressure falls. That narrow artery now cannot overcome resistance. The muscle enters ischemia. Lactic acid accumulates. pH drops. Nerves fire. You wake up. Now here is the detail most doctors skip. Plaque is not smooth. It has a fibrous cap. Beneath it is a lipid core. As blood rushes past a narrowed segment, it creates shear stress. That stress peels the endothelium like old paint. Microtears form, platelets stick, clots form. This is how stable disease becomes unstable. This is how a nighttime ache becomes a sudden arterial blockage. And once flow drops below a critical threshold, tissue dies. Not slowly, rapidly. Now look at the diameter problem. A normal femoral artery at rest delivers several hundred milliliters of blood per minute. Narrow it by 50%. Flow drops dramatically. Narrow it by 70%. Flow collapses. This is physics, Poiseuille's law. Flow is proportional to the radius to the fourth power. You lose half the radius, you lose almost all the flow. This is why mild narrowing is not mild. Now remember this, muscle pain from cramps does not follow arteries. It follows muscle groups. Pad pain follows blood supply. That distinction matters. Now let us expose the most ignored structure in this entire disease, the microcirculation. Capillaries are one cell wide. They deliver oxygen directly to tissue. Diabetes destroys them. High glucose glycosylates proteins. Capillary walls thicken. Diffusion slows. Even if your large arteries look acceptable, your tissue can still starve. This is why some people have normal pulses but still have PAD pain. Doctors miss this. Now here is the open loop you need to hold on to. Your skin, hair, and nails record this entire process. They change months or years before severe pain appears. Most people ignore these signs. Doctors rarely connect them. In the next part, I will show you how your body has been warning you quietly. Dry skin, shiny legs, hair loss, brittle nails. These are not cosmetic issues. They are vascular alarms. And there is one sign in particular that predicts limb loss with terrifying accuracy. Almost no one recognizes it. By the time pain forces your attention, the damage is already old. Your body warned you, repeatedly, quietly. You ignored it because the signals did not hurt. Peripheral artery disease advertises itself through tissues that regenerate fast: skin, hair, nails. These tissues live at the end of the supply chain. They suffer first. They fail first. Let us dissect them one by one. Start with your skin. Healthy skin is warm, elastic, slightly oily. It reflects good perfusion. In PAD, blood arrives late and leaves early. Oxygen tension drops. Sebaceous glands slow. Sweat glands fail. Your skin becomes dry, ashy, paper-thin. Shin skin turns shiny because the outer layers atrophy. Light reflects differently off starving tissue. This is not aging, this is ischemia. Now look at color. Elevate your leg for 1 minute, then let it hang. If it turns pale when elevated and deep red when dependent, that is not normal circulation. That is reactive hyperemia. The vessels dilate desperately when blood finally arrives. This color shift is a signature of arterial insufficiency. Now hair. Hair follicles are metabolically active. They need constant oxygen. In PAD, the body makes a ruthless decision. It diverts blood to organs that keep you alive. Heart, brain, hair becomes expendable, so it falls out, not in patches, uniformly, from the toes upward. Men notice it first on the shins, smooth, bald. Women notice it as sparse ankle hair and slower regrowth after shaving. This is not cosmetic. This is a map of blood flow failure. Now nails. Nails grow from the matrix under the cuticle. That matrix needs blood. When supply drops, growth slows. Nails become thick, ridged, brittle. They yellow because cellular turnover slows. Debris accumulates. Fungal infections take hold because immune cells cannot arrive efficiently. Doctors treat the fungus. They miss the ischemia. Now let us talk about temperature. A healthy foot is warm. A pad foot is cold, not slightly cool, cold, chronically, even in warm rooms, because blood carries heat. No blood, no warmth. People wear socks to bed. They think it is comfort. It is compensation. Now here is the sign that predicts disaster. Wounds that do not heal. A scratch on the shin, a blister on the toe, a cut from trimming a nail. In normal circulation, healing begins within hours. In PAD, it stalls. No oxygen, no collagen synthesis, no immune response. The wound stays open. It darkens. It crusts. It deepens. This is when infection walks in. And here is the terrifying part. PAD pain can disappear at this stage. Why? Because the nerves die. No blood, no nerve function. So the absence of pain is not relief. It is failure. This is why amputations often surprise patients. They say, but it stopped hurting. Yes, because the tissue died. Now let us connect this back to nighttime symptoms. Early PAD causes nocturnal ischemic pain. Late PAD causes rest pain relief by nerve death. That transition is silent. Now pay very close attention to this next mistake. People assume cramps happen only at night, but PAD pain can also appear with walking. This is called claudication, a deep ache in the calf after a predictable distance. It stops with rest. It returns with movement. This is the muscle asking for oxygen. But many seniors stop walking before they reach that distance. They sit, they adapt, so they never trigger the pain. The disease advances unseen. Now let us talk about sensation. PAD alters nerve conduction. You may feel tingling, pins and needles, numbness. This is often blamed on neuropathy, especially in diabetes. But neuropathy and PAD often coexist, and PAD makes neuropathy worse. Because nerves also need blood. Now here is the open loop you need to hold. There is a simple home test that reveals whether your pain is muscular or vascular. No equipment, no clinic. 3 steps. Most doctors never teach it. Most patients never do it. But it can change what happens to your legs. In the next part, I will walk you through this test in precise detail. Exactly how to position your body, exactly how long to wait, exactly what result means danger. And there is one step that people always skip. That step makes the difference between false reassurance and truth. This is not a diagnosis. This is a filter. It tells you whether you are dealing with muscle misfiring or blood failure. You need a bed, a chair, a clock, nothing else. Step 1, elevation. Lie flat on your back. No pillow under your knees, legs straight. Raise both legs to a 45-degree angle. Hold them there for 60 seconds. Watch your feet. In healthy circulation, color stays pink, maybe slightly pale. Uniform. In arterial disease, the foot drains. It turns pale, chalky, gray. This happens because gravity removes blood and the artery cannot refill fast enough. Now pay attention to sensation. If you feel tightness, a dull ache, a pulling pain in the calf, that is ischemia. Muscle cramps do not appear with passive elevation. They need contraction. This is the first separation point. Step 2, dependency. Sit up. Let your legs hang off the bed. Do not stand. Watch the color return. Normal circulation restores color within seconds. PAD delays it. The foot turns deep red or purple before normalizing. This is reactive hyperemia. The small vessels dilate wildly to compensate. Now feel the relief. If hanging your leg down eases pain or pressure, that is arterial. Muscle cramps improve with stretching, not gravity. This is the second separation point. Step 3, the refill clock. Press your thumb firmly into the pad of your big toe. Hold for 5 seconds. Release. Watch the color return. Normal refill is under 2 seconds. 3 seconds is slow. 5 seconds is failure. This is capillary refill. It reflects microcirculation. Now here is the step everyone skips. Repeat the test at night, in the dark. When symptoms occur, daytime results can lie. Nighttime exposes the truth. Because blood pressure is lower, heart rate is slower. PAD reveals itself then. Now let us interpret outcomes. If elevation causes pallor and pain, suspect PAD. If dependency relieves pain, suspect PAD. If refill exceeds 3 seconds, suspect PAD. If all 3 occur together, this is not a cramp. Now understand the limits. This test does not detect early plaque. It detects functional impairment. That is what matters clinically. Now let me address a dangerous misconception. People think strong pulses mean no PAD. Wrong. You can feel a pulse and still have severe disease, because pulses reflect pressure, not flow. Collateral vessels can transmit pulse waves without delivering oxygen. Doctors know this. Patients do not. Now let us talk about what this test cannot do. It does not tell you location. It does not tell you severity. It does not replace imaging. It tells you whether to stop dismissing symptoms. Now here is the open loop. There are myths about cramps, magnesium, and aging that delay care. There are also new medical guidelines and coverage changes that affect testing and treatment. In 2026, these changes matter. In the final part, I will dismantle the most dangerous myths. I will explain what has changed in screening and management, and I will show you how to connect this problem to the rest of your vascular health. Because PAD is never isolated. It is a system failure. Now we strip away the lies. Myth 1. It's just aging. Aging does not narrow arteries, damage does. Endothelial cells do not die because of birthdays. They die because of glucose spikes, pressure overload, and toxins. If leg pain were normal aging, amputations would be inevitable. They are not. They are preventable. Myth 2. Magnesium will fix it. Magnesium helps electrical instability in muscle. It does nothing for a blocked artery. If magnesium relieved your pain, you had a cramp. If it did nothing, your problem is supply, not signal. Continuing supplements in the face of ischemia wastes time. Time is tissue. Myth 3. I only feel it at night, so it can't be serious. Night pain is worse. It means resting blood flow is insufficient. That is advanced disease. Pain with walking is an early warning. Pain at rest is a red flag. Pain at night is the flare gun. Now listen carefully to this next part. Most general practitioners still miss this. Peripheral artery disease is not diagnosed by symptoms alone. In 2026, objective testing matters more than ever. The ankle brachial index is the starting point. Blood pressure cuffs on arms and ankles. Ratios calculated. Normal is above 1.0. Below 0.9 is disease. Below 0.5 is severe. But here is the problem. In diabetes and kidney disease, arteries calcify. They become incompressible. The ABI looks normal. The disease is not. This is why toe pressure testing and Doppler waveforms matter. This is why relying on symptoms alone fails people. Now let us talk about what has changed. In 2026, screening thresholds have shifted. Patients over 65 with risk factors qualify for non-invasive vascular testing earlier. Diabetics qualify sooner, smokers qualify sooner. Delayed diagnosis is now recognized as a system failure. Treatment has also evolved. This is not just about stents. Supervised exercise therapy remains one of the most effective interventions. Why? Because it forces collateral development. It improves endothelial function. It increases nitric oxide production. Movement remodels arteries. Medications matter. Antiplatelets reduce clot risk. Statins stabilize plaque. Not by lowering cholesterol alone, by reducing inflammation and strengthening the fibrous cap. Blood pressure control matters, because shear stress damages plaques. Glucose control matters, because sugar is toxic to endothelium. This is system repair, not symptom suppression. Now here is the final truth. Nighttime leg cramps and peripheral artery disease are not enemies. They are messengers. One tells you your muscle misfired. The other tells you your circulation is failing. Your job is not to silence the message. Your job is to decode it. Ignore cramps and you lose sleep. Ignore PAD and you lose tissue. And once tissue dies, medicine cannot resurrect it. Now I am going to close the loop. If you understood this video, you now understand something deeper. Leg pain is never just a leg problem. It is a window into your entire vascular system. The same plaque starving your calf can starve your heart. The same endothelial damage can trigger a stroke. Your legs are telling you what your arteries are becoming. In the next video, we are going to follow that trail upward from the legs to the heart, from claudication to cardiac risk. Because the people who catch PAD early do not just save their legs, they save their lives.